Good evening, everyone, and welcome to this edition of the Health and Wellness. My name is Nellie Greer, and I will be your host tonight. First of all, I'd like to talk about updates that have happened since we moved in December of last year. We have actually signed up with Yelp and completed a video which was filmed for advertising our business, to let the public know a little bit about what our business is all about. We encourage everyone to find us at Yelp and to give us a comment on what you think about the video that you saw. Also would like everyone to give us little ideas as to what you would like us to address in the future in programming. Maybe some concerns that you have in health or in any other area. We have also added a big screen TV, as you can see, in our center, so that we can show documentaries and videos that are either too long in time to show on cable and or of sensitive material. But you can also come in and to our center and view whatever programming you have missed, or maybe something of some topic that you would like to see. You can come in and while you're shopping, you can watch the whatever video is being done that day. Also, for those folks that don't have Comcast, because Comcast is you can get Channel 6 Metro Cable Network. If you have DirecTV, you won't get Channel 6. So for those folks that don't have Channel 6 because they have DirecTV, they can actually go to our homepage, which looks like this, and on the that corner, on the left-hand corner, you click onto the YouTube, and once you're there, what happens is it has all the page on all the videos that we've done, some of the videos that we've done. But and on that page, if you hit on to extra, to the video, to extra videos, you can see all the other videos that we've done that are posted. Also, if you click onto the bar where it says subscribe and you click onto that, what you get is the page where it tells you to enter your email. And if you do that, then what happens is you're able to get a link every time that we have a new programming, and then you get to watch it on the computer or maybe on your iPhone. In today's program, what we're going to talk about is don't really want to talk about products so much. What I wanted to do is to talk about facial mapping, and these are all charts. So facial mapping, dental mapping, and I'll have charts on maybe ear and irology charts, the eye, and also hands and feet. When these charts are actually like VitaFlex points. So a lot of times, you know, we've done programs on for essential oils, and they tell you pretty much where to put the essential oils, either on your spine, on different parts of your hands or maybe feet. And the same principle applies to the facial. We have the facial chart. You know, we're gonna talk about all the concerns and the things that are affecting your health in one way or another. Talking about the different charts as to how we can map our concerns, how people go to the doctor and they get all these different tests done, only to find out that the tests all come out normal, and they leave there thinking, this is crazy. How is it that I feel all these different things, and yet when all these tests are done, all this money is spent on all this time, and I feel like I'm going crazy because I do feel this certain way, and yet I go in and I get all this done, and all they tell me is that all the readings are all normal. How can that be? And the idea is that you're not going crazy, and you do have these symptoms, and you do feel those things that you say you do. However, a symptom has to be there present for a long period of time. It has to be, you have had to been working with that condition for 5 years or over, because the truth of the matter is that it will not transfer to any machine. No machine will read anything that is less than that. And so you're not going crazy. It's real. So the idea is that we're going to give you little formats as to how you can look at your face and maybe, or look at your teeth, and we're going to go with that as well. We're going to talk on that. And see what it is that's happening. So if we look at the behind me, you'll see that on the forehead, if you look at your forehead, you will see that if you have any markings, fading, different, imbalance of the skin, it's due to, like, and when you sweat, if you sweat a lot on your forehead, know that you're detoxifying in those principal areas. So it affects your digestive, those are digestive problems, small intestine issues. It's liver issues, it's irregular sleep schedule, and there's toxin, a buildup, and that's stress and worry and sweat. Now on the other side, if you look, and it's ears and temples, that is kidneys. So chances are, if you look at where the arrow is pointing, know that the kidneys all relate as to different conditions that you might be having, and it could be dehydration, poor lymphatic circulation, diet too high in fat, too much processed foods, and stress and excessive oil production. That's your kidney area. And so, and also know that a lot of times if you drink, let's say Saturday night and Friday and Saturday you drink, then chances are it's going to show on your face. And most people will always say, oh, I looked like I'm dry. It's like I'm totally dehydrated. And the very first thing you do, it's either drink lots of water that day, or you end up with a big headache, and you drink something that has calcium in it, like milk, to settle your stomach. And anyway, those are ways of being able to target at those things. But most people, when they go through that time of doing these things, they kind of right away know what's going on. Also now, on this side over here where it says between the eyebrows, that is your liver and your stomach. And that's dehydration, too much alcohol, and greasy food. Now know too that on the nose, a lot of times if the nose becomes too red, for people that drink alcohol, becomes too red and the pores become very big, that is an indication. And so now you know that that's the reason. When you come on this side where it says the nose, the middle part of the nose is the heart, and it's blood pressure, poor circulation right here. And it's poor diet, it's constipation, bloating, gastrointestinal imbalances, indigestion, and salt intake. And that has a lot to do, and you can kind of see it on how the nose becomes very swollen, very red. Now, on the other side, it's eyes, under the eyes. The under the eyes, it's kidney related, and a lot of times this happens a lot to diabetics and also people that have liver issues that they have dark circles in the eyes. It's all liver related, that it's toxic. And it's lack of sleep as well, dehydration, dirt from makeup, and rubbing eyes. And in that case, a lot of times people take some lemon and they do a cotton ball and they do lemon around the eye to lighten the eye, the skin. But the best thing to do is, do a liver cleanse to be able to take care of that. And also on this side here where it says the right cheek, on the cheek area on the right, it's allergies. So you see how doing the mapping, how you can decipher exactly what it is that you're doing, and then you can address it and fix it and work with it. And that's allergies, and that's stomach problems, too much sugar, stress, dirt, and dirt from the pillowcases and phones. You know, I want to say that a lot of times, you know, we talk about using the Miracle 2 products in order to cleanse your pillowcases and your sheets and blankets, because in doing so, what you do is you end up keeping the skin nice, because as you sweat, you're not taking in the toxic soaps from the soaps that you buy at the supermarket. This Miracle 2 soap doesn't have anything, and so it cleanses whatever you wash. It cleanses it really good and without any buildup of any toxins. Over here on the left side on the cheek is liver, and that is overeating, malabsorption of nutrients, stress, stomach problems, poor air quality, pollution, dirt, from pillowcases. Usually the cheek has a lot to do with it. And the same thing with wrinkles. When you smash your face in a pillow, it tends to create wrinkles. So the best thing to do is maybe get one of those cylinder. It's just a long, you know, pillow that bar that you put under your neck, and so you're resting, but your head is resting on the bed, and your neck is the only thing that's being supported. You're not, you know, with all the smashing your face on a pillow. And also, if you sleep on your stomach, that's another bad way, because that kind of it stresses your neck, and so you end up getting up and you feel stressed out when you get up. Now, this one is a big one, because around the lip, it's hormonal and intestines. And it's funny because hormonal, ovulation, reproductive organs, a menstrual cycle, constipation, irregular bowel system. You know, around the up here on the lip, you know, it's funny because I remember when I was younger and I had my kids, I would always end up with a line across the middle part of my lip, and I couldn't figure what that was, and it was pretty visible, and every time I spoke, it would, like, you could see it. It was like a total fold, and I didn't think much of it, but it just kind of bothered me. And then as time went by, guess what? It just fixed itself, and don't have it anymore. So there are things that happen to us every 5 years, every 10 years, and you can address them, you can work with them, and sort of see what it is that's going on. And this is a perfect way of doing it. It's the facial mapping and the dental. As I get into it, you're going to see that this is quite amazing. The chin is a big one, and the chin is where hormonal problem. It's stomach, kidney, reproductive organs, and it's kidney imbalances and greasy food, dehydration, hormonal, gynecological issues, and that too. So it's upper lip, and so the mouth has a lot to do with reproductive and hormonal and all that. The other one that I missed was the jawline. The jawline here is it's hygiene and stomach. It's dirt and greasy foods. So the jawline is really funny, and that is where if a person takes medication, arthritis medication, and they're taking it, and the doctor keeps changing their meds, they tend to create their whole face structure changes, because it's sort of, you get like pockets. It's almost like your face gets bigger and your jawline increases, and it's almost like it's deforming you in a way, and it's all the meds. It doesn't say it here, but it's that. And and also the dirt and the greasy food. Greasy food is an accumulation. The same thing as if you eat things that you can't tolerate, your body stores different toxins in different areas. So a lot of times you might be eating certain things, and that's what happens. It stores in different parts of you, and so that's a tail sign. The neck part is the last one, and that's the illness, and that's thyroid. So the neck kind of says a lot, and it usually says if it's thyroid issues, it'll be big, and or if it's either way, there's a dysfunction that happens that is very visible, and you know that that is what's going on. Now that is the facial mapping. I also have different acupuncture. I do have an acupuncture page, and that is, so on this one, this is an acupuncture facial mapping, and you can see it's slightly different. It has a different take to it, but it gives you a little bit more information, and all of it is good. It just really teaches you a lot of the things that you can find a lot of things that are wrong just by looking at your face. It's quite amazing, and when you address, there is a way of addressing a lot of different things that are going on in your face. We have a drink that's the Barley Life Green, that what I do is I take some of that green and I put neutralizer. Instead of using the water, I use neutralizer liquid, and I mix it and I make a paste and I put it on my face, and it goes on wet and then it dries. But because those are active minerals in there, what happens is, and it's got all good, and it's green and alkalizing, when you put it on, it feeds your face, it feeds your skin, and you don't want to let it totally dry, like real hard. So you wait probably like 5-7 minutes, and then you rinse it. And when you rinse it, your skin is clean. If you have any brown spots or anything like that, any damage from the sun, it just totally fixes it. And so that is, something that you can do, and in bettering the skin. We do have different charts that we've got available, and we can actually give so that anyone that would like, when they come in and they want to maybe talk with us and want to know more about what things to do, what things to take in order to fix whatever condition that they're trying to do, you know what? We can sit down, and then I can tell you the different products that you can use that are needed for that particular thing. Okay. We're going to talk a little bit about, we did the mapping. I wanted to say that we're going to talk a little bit about the dental. When you look at the upper teeth, know that, everybody's sort of, there are things that happen. As we age, we tend to have problems with our teeth. And it's all because either we're not eating correctly, we're not taking in enough minerals, our circulation is not good, the blood isn't flowing very good to these areas, and also the food that we're eating is not good. It's more robbing and hurting our immune system as opposed to helping us. So the frontal of the teeth has to do with kidney and bladder. It also has to do with the prostate and the uterus. And so if you see that those are the areas that you have problems with, then know that those are the areas that you have to concern yourself with. And you know, if you have kidney, bladder problems, you already know it. And the fact that now the front of your teeth are bothering you or hurting you, then you know that the correlation is real. And so the idea is you maybe are taking things for kidney, bladder present, or maybe not. And if you aren't, then maybe you should. And we do have formulations for kidney, bladder, for weak kidneys and weak bladder. And also, you know, I get a lot of people that call and say, you know, I don't want to do dialysis. What do I take for? We do have certain things that address through essential oils and also through different formulations directly just for that. Also, the following that on the side teeth to that is your liver and gallbladder. Now, a lot of times those problems won't hit us until later in life. Molars usually do early. So a lot of times people will have issues and they have the cavities more in those areas. And so know that on that is stomach. You can kind of see it's lung, colon, and also the back molars are stomach and thyroid, and you can see that, and pancreas. Also on both sides you can see that on the right side you can see that below the lung colon it's your stomach and thyroid and spleen. So, and then further down is your heart and small intestine. So depending on where it is, you know, that you have issues on your teeth, then know that that's the areas that are affected. And by addressing those things with different products that are going to nourish and help you, silica is good, calcium is good, and magnesium. You know, it is said that if and when you take calcium, and a lot of times doctors will say, don't do calcium. The calcium is you're storing too much calcium, and then you end up with stones. And so the doctors, they say no calcium. But the idea is, and they're right in saying that, because either you're taking the wrong calcium, or what happens is arthritis. If you take, this is a big one, if you take calcium and you don't take enough or adequate amount of magnesium to process the calcium stores because it doesn't have the magnesium to help it be absorbed. So the idea is that by taking magnesium, when you take the calcium, that helps to break it down. The vitamin D3 is also needed, but more so than anything is the magnesium. And so sometimes when people say, I have arthritis really bad, osteoporosis really bad, or I have joint issues, the joint issue is that the calcium that you've been taking has not been absorbed, and it's locating itself to the joints, and that could be in your knees, on your back, arms or hands, or wherever you have the pain. It's all due to that. In increasing the magnesium, you will find that for every time you take the calcium and do more magnesium, you will actually absorb that calcium that you took. And if stones have been created, then what you need to do, there's a formulation that we have people do, and it dissolves the stones, and don't have to have surgery. You know, a lot of the things that can be done, it doesn't have to be complicated. It's so simple that most people, they say, you know what, it's too simple. I don't think that can be. But the truth is that it's the nutrition is the lack of nutrition is what causes the illnesses and the concerns that you have. It's maybe you're doing things, too many things, or maybe you're doing things that are not combined right, or maybe you're not taking them at the right time. You know, here in the center, that's what we cover. We help you and we educate you to be able to know exactly what it is that you can do in fixing something that you're probably doing. You're just probably not doing it at the right time, or maybe you're missing one or two things. Okay, I had a lady that, and I'm just going to say this because I just got done talking to her today. She called up and I had sent her some clay. And she said that she had gone to her doctor, and her doctor said to stop everything. She lives up north, and I don't get to see her much, but she got involved in a company, and they're selling her so many things, and she's totally confused. And so I told her, the doctor told her, stop everything. When she called me up, I said, that's great. That's the best thing to do, because clearly she's so confused. She's multiplying certain things. She's buying everything that they're selling, and she doesn't really need it. The things that she needs is simple. Just a vitamin that's in a liquid, something that's going to be driven, that's going to feed her, no confusion, and maybe clay, because clay picks up all foreign matter, foreign chemicals, heavy metals, and it helps the gum tissue, and that's a big one. You know, you do clay, edible clay, and edible clay is one that people are very confused. You know, you tell them about clay, edible clay, and they'll go anywhere and pick up whatever clay, and they don't really study what clay they're really taking. And it's very important, I should say, that what you take internal to be the right clay. The clay that we carry is mined. Surface clay is for different conditions. For surface, more agriculture. And then the second layer, or the 12 feet down, is more for pets and to bathe. And then further down is the clay that we end up getting, because that's the clay that is got the most energy, and it's got the most minerals, and it's clean, and it's dry, and that's the clay that we want. It's the edible clay that puts the nutrients back into our system, the minerals that we need, also the iron. We need iron as well to some degree, and the clay has it. And also it has a negative charge. It has an 8.5 pH. It's the best clay, and that is what that lady needed. She needed something to just clean all that she's been storing of anything and everything that she's been doing. Clay really works in mouth. In fact, when you have dental issues, the clay helps with pulling all the toxins and heavy metals and mercury and from fillings. And when you have issues with swollen gum tissue and stuff, it's stress related. It is amazing how your mouth tells you how acidic your body really is. And that is what we're trying to do. We're trying to not so much, it's basically to let you know that in checking things out, even your skin, when you check your skin, you know that something is not right. Because why would you have a rash? Why would you develop eczema, psoriasis? There's got to be something greater, internal, that's going on. And that is exactly what this is all about tonight. Also, I wanted to talk about when we're stressed. I wanted to say one thing before I don't forget. We have, all right, behind me you'll see that this is the Ionic detoxification, and I'm sure everyone has seen this done. If they haven't done it, gone someplace and had it done. Maybe you own one of these units and you do it for yourself. But anyway, the idea is that if you have done this, you know how the water changes. Now, let me tell you something. when all your points, all your reflex points, all your organs are on your feet. They are on your hands. They're on your ears. And the face mapping, your teeth. Now, all these different areas, when you detoxify through your feet, you actually, it's like the circulation goes all through. And the first layer that goes out, it's usually any calcification that you have around the heel part, on the sole of the foot, and also on the toes, because a lot of times you have rough callus done in those areas. The heel part and the not so much on the center of the foot, on the arch, but more on the sole of the foot and on the bottom and on the edge, on the end. And what that happens is when you put your feet on that, what it is the first thing that it takes away is, and the reason why the water changes is because it's actually melting that calcification that's going on around those areas. That calcification is your feet sweat, and but it sweated so much, it detoxified so much, and it created a hard callus. And so what happens is that sat there. Now your organs haven't been detoxifying because you have that blocked. Those areas have been blocked. So it's like it's mounting, and it's mounting. And you take baths and stuff, but unless you get rid of that thickness, your feet are not, or your body's not really detoxifying through your feet. Because every time you put socks on or nylons or whatever, you find that your feet, when you get stressful, when you get nervous, your feet tend to sweat, and your hands are wet and your feet are sweaty. So that's an indication that your body is detoxifying because of stress or nervousness. So the idea is that when you put your feet on this solution and in water, what happens is it dissolves those patches, and there is so much detoxification that has happened there, that's been pasted on there, that the first thing that you see is the change in the water, and that is all due from that. And that's the reason why it's recommended to do it again and again, because a lot of times the very first one is the worst one. Now, when it actually repairs acne and rashes, it deactivates viruses, bacteria, yeast, and fungus. It assists in weight loss, headaches, and headache relief, slows down aging, and improves body flexibility, rejuvenates and energizes your whole body, enhances nutrition absorption, heavy metal removal, and increases energy. Now, if you see the back of it, this is really a good one because it shows you particles, color and particles. It shows you that if the water turns completely black, it's detoxifying the liver. If there's specks, if it's black specks, know that it's heavy metals. If it's brown, it detoxifies liver, cellular debris and also tobacco. Dark green is detoxifying the gallbladder. Orange, detoxifying from joints. Red specks is from blood clot materials. And white cheese-like particles is like most yeast. And the white foamy is detoxifying from lymph system. The yellow-green is detoxifying kidney, bladder, urinary tract, female prostate area. Now, we do have a lady that does this. She not only does the ionic mineral bath, she also does reflexology, and she does lymph treatment. So a lot of times when people have issues with feet, swellingness and stuff, by doing this treatment, guess what? A lot of it goes away. And then when a person goes home after that, they end up continuing the process, some of it in doing the foot baths with maybe the Miracle 2 products. And that assists in doing the work, continual work at home, and then maybe visit with her again, and she'll kind of let you know exactly what you need to do after that. But however, those are things that you can do and assist in detoxifying and help yourself in detoxifying better. I was going to say that read a little article that said, we are so stressed these days, and a lot of these conditions that we have, either dental issues, swellingness, that we have maybe pain, it's all due to stress levels where we don't breathe correctly. And it causes a lot of different problems. I'm just trying to find my page. Okay, here it is. And the problems relating is, it's kind of like, the correction is like breathing. Now, simple, you would say. Is that all there is to it, I hear that so often, people say. But the truth of the matter is that when you're depressed, when you are fearful, when you have anxiety, you know what? It's breathing. It's as simple, and that's why I often say that most of the problems today, they are so simple that when people hear it, they think you're nuts. They think, yeah, right. But I'll tell you something. In breathing, what happens is, and that's the reason why we connect an essential oil, so that a person, when they do this, they connect right away. The minute they breathe a certain oil, it's like their eyes open up, they get it. And so the idea is, breathing is very important. It actually changes the pH in your system. It stimulates your brain. The other thing that it does is, too, do you know that when you work out and you run, you're breathing more oxygen, and that is the reason why you get this high. But not only are you getting that, the other thing that's happening too is that for whatever action you're doing while you're breathing, you are actually burning fat in those areas. So when you do a physical activity like aerobics, or if you do any exercises like raising your leg or doing stomach exercises or just doing weights, whatever part of your body that you're working on, by breathing, you're actually addressing that area of your body and burning fat in those areas because of the breathing of oxygen. Oxygen is what burns fat. Now, and also it's what burns fat in those areas, so you sculpture those areas. Now, stress, when you think about it, comes about because of the lack of breathing. So the idea is that you will be, if you don't breathe sufficient, you will be scared. You will have anxiety. I had a friend, neighbor, that went to the mall, and it was just too busy. And her and her daughter, the mom just got really anxious. She just got so nervous, and she said, it's too busy in here, I just got to get out. And the whole thing was, somebody just said, sit down, put your head down, and they gave her a bag and they had her breathe. Guess what? It was breathing. The minute you start breathing, she was okay. When those things happen, you stop breathing, you don't know that you're stopping breathing, but you're not breathing sufficient, and then you faint because of the breathing. So anything that's occurring, that's happening to you, if you're stressful, if you're fearful, if you have anxiety, whatever action it is that's occurring to you, afraid, scared, whatever's going on, if you sit down and just breathe and get it together just by that, you will see that everything will change. Essential oils are very good that way because they channel and they make you get it. It's like the minute you breathe, it goes to your brain, your eyes open up, and it's like it's like your face just changes. You sort of glow because of the frequency that you're getting through the oxygen to your brain. Teeth are the same way. When your body is stressed, the more stressed you are, the more things will happen to you. Depending on how weak you are in whatever particular area in your body, the stress will always go to that area. And that's the reason why you often hear about people having where they totally faint, or where they have heart palpitations, or everybody relates or works differently, and so occurrences on everything happens differently for everyone. For eyes is a big one. When your body is too acidic and it's stressed, it will start to dry the membrane internal. And so a lot of times when folks have a lot of issues with dry eye, the things that are given, the things that you buy at the store, the things that your doctor gives you, that's probably okay. However, I will tell you that working with the neutralizer water, by putting the neutralizer back and cooling your eyes with minerals, it fixes it. So there's so many things that dry mouth is another one that diabetics have it. Thyroid, people that take thyroid medication have dry mouth. Guess what? If and when you take the neutralizer and you start brushing your teeth with the neutralizer gel and the miracle soap, guess what? That too will subside and you will fix that. Also, adrenals. When a person has a lot of stress levels, guess what? The more stress you have, the thyroid gets affected, the adrenals get affected. Those are things that you need to sort of look into as well. Blood sugar is a big one. I will tell you that blood sugar is such a big one. It can affect you in many different ways. I had my grandson when he was little, and the mother would pack, lunch for him. It wasn't sufficient. My grandson, one of the things about the blood sugar is that my grandson, when he was little, he got, he couldn't see. He had some seeing, he couldn't see. He thought he needed glasses. And the mother would pack lunch for him, and apparently, what he was eating in the morning wasn't sufficient to carry him through, because blood sugar issues kind of, in the morning you eat, but by 10 o'clock and 10:30, you got to eat something, because that's the time that your body's working, the energy in your stomach is working the highest, and so consequently, because of that, your blood sugar gets affected, and things get processed a little quicker, and so by 10 o'clock he needs to eat, and he has to wait till noon. So the idea is that he just blacked out. He was like, had a fainting episode. And my son said that they took him in and they realized that he needed glasses. And I just said, no, I don't think he needs glasses. I think what it is he's got blood sugar issues just like us. And I says, I have hypoglycemic and my son does too. And I said, I know he probably has the same thing. I just said, okay, don't do the glasses so quickly, just wait it out. And sure enough, I told my grandson, this is what you need to do. Pack a little peanut butter, pack a little, some crackers, and maybe some fruit that you can kind of eat within that time period. And you're going to see that that's going to be fine. Well, he understood what we were talking about, and he said, okay. So he did it. And sure enough, guess what? He got his glasses. Does he wear them? No, because he doesn't need them. He actually was okay. And the fainting spells, they didn't happen again. They thought it had something to do with his heart or something. But the truth is he was fine, because it wasn't nothing like that. It was blood sugar issues. We have had people, truck drivers, that have had issues this similar way, where they just don't eat. They go on the road and they go, I don't want to stop. I just want to, be able to just keep going, so I don't have to stop and have to go to the restroom. And so they don't eat, they don't drink, they don't do nothing. And then when they get there, then they eat. Their blood sugar, they said, one fellow said, I got this splitting headache. I think I got a tumor. And I said, when he came in, I said, do you eat sufficient in the morning? He said, no, I don't eat in the morning. I said, do you eat lunch? He said, no, I don't eat lunch. And then I'm going, okay. And then he says, I just eat one meal a day, and all day long I got this headache. And I'm going, okay. When I told him what it was and I told him what to pack so that he has something in the truck that he eats, he started to do that, and it wasn't no tumor. It was none of those things. And it was basically that his blood sugar would drop and give him a headache. Usually blood sugar symptoms are going to be blurry vision. You can't speak clear. You can't pronounce half of the things. You can't see very good, and you get very dizzy, and then you get very shaky. So the idea is that when it gets to that level, when you're young, you can do these things and they're okay. As you get older, by the time you're 40, whatever condition you've been working on that you've exhausted because you've done it and done it so much that you've made your matter really worse or bad, then chances are what's going to happen is by the time you're 40, you can't do that anymore, because now you could end up having a stroke. So the idea is that those are the things that happen to folks when they abuse and they keep doing the very same things and they think that they can bypass all that. There's one point in time in your life that you can't do it anymore. And that is by 40. That's why all the different things come about within that time. Because your body now says, can't do it no more. It's, you've actually exhausted everything. I wanted to talk about the oxygen. I read a little article where it said that that the environment, the reason why there's so many folks that are so stressed. I hear this a lot, where I heard it from my son, where he said, he's a manager at a Costco, and he said, he said that his one of the bosses ended up so stressed out that he just turned his keys in and walked out. And a lot of folks are getting to that point where the stress is so high, and not that the stress is any different, it's just that the person can't handle the stress any longer. And the idea with this is that our level of oxygen in our environment today it used to be above 38. Because of all the building and highways and just all the development that's been going on, there's less oxygen in the air. Today, it used to be above 38% oxygen in the atmosphere. Today is below 21. And we're not supposed to be breathing 21. We're supposed to have more than that. And do you know that at 6%, we suffocate? So the idea is that that's why it's important to do essential oils in your house, not just a feely-good spray, and essential oils that are very therapeutic. And the therapeutic oils are the ones that are 100% of that what is labeled, and no mineral added to it, and none of the adulteration to be done on it. And the principle is that, it used to be in the 70s where people had plants in their house, and that's good to have plants because they put oxygen in the air. And but now people don't even do that. They either have artificial or they don't have any. So the idea is, for those that don't, by doing essential oils and diffusing essential oils in the air, it's really good. It actually and that's the reason why every time you diffuse oils in the air, people always say, "Oh, this is so awesome," and it makes the environment very calm, and people often say that when they come into our center, because we're always diffusing essential oils in our space. The ear. Okay. Lastly, I wanted to talk about the ear, the mapping of the ear as well, because You know, when you go to a chiropractor, no, an acupuncturist, excuse me, an acupuncturist, they will actually put all these needles all over the place depending on what it is that you went in there for, and you sort of question on why there, you know. And but through mapping, you can actually tell all the different parts that are on your ear. You know, it's funny because have you ever hurt yourself, or have you ever gotten slapped or punched or in one area only to feel it in another? Or have you stepped on something and only to feel it in your heart and in your stomach? Because that's exactly what happens. The parts, all the organs that are on our hands, on our feet, ears, face, it's indirectly, it's almost like whatever you hurt in those areas, you actually hurt stomach and heart. You feel it in different areas. And so when the acupuncturist does needles, that is what he does. He basically will actually look at headaches or whatever. They'll address on the ears, and they address it also on the different parts, other parts. But on the ear is quite good. It's it says number 1, which is on the very top of the ear, and that's tonsils. And the number 2 is kind of on the bend, on the ear bend. You can see the number 2 there, where it says for blood pressure. So a lot of times when we address essential oils, you can take this this tool, this glass tool that you end up soaking the oil on, and you do it and you go right to that tip, or you can just wet your finger and put it in the areas for the blood pressure. So you know exactly on number 2 that that's blood pressure. Also on number 3, following that, you can see there on number 3, that's for depression. And also 4 is for hepatitis, and you know, for asthma, and all the different areas. It kind of tells you exactly all the different areas. That for the adrenal gland is 16. And also on the bend, you know, it's funny because the folks that have a piercing, usually when it goes to the 39, a lot of people have piercing done on 39, and the 39 is liver. And also that's cartilage. When people hit that, you know, and a lot of times there's people won't pierce those areas, but also in 31, it's thyroid. The 31 is thyroid, so it's on the lower part of the ear. And let's see, what's 23? 23 is nervousness. So a lot of times, or even for weight, I know that a lot of people say if you pinch for, and then down below it tells you for mouth, and also the inner ear. So this chart, these charts that we are looking at, that is for mapping all these different things, you can come in and I will make copies so that you can use them. That way there, it helps you in working with essential oils, so that when you have an essential oil and you have a certain condition that you want to work with, you can actually use the oil for that condition and then put it on those areas. Not only hands, but you can do it also on ear, and you can also do it on your feet, or you can do it on location. The thing with the face is you can't quite do essential oils, different essential oils, like for eyes especially. You want to do the essential oils, maybe a lavender. You don't want to use, for people that have dry eye, the best one is taking peppermint oil, putting it on the palm of your hand, go like this, breathe it. The minute you breathe it, what happens is the frequency goes right to your eye and it makes your eyes water. That's all you need, and that it takes care of dry eye. Now, if you have eyes that that weep a lot, you can use frankincense, and you can just dab it so that you wet your finger, and then you just go around the circular of your eye, and the frequency travels. Also, lavender is another one that you can do around the circle of your eye. So it's like the bony circle of the eye, and all you do is just do that. So there's a lot of the essential oils. There's one that is done for face that has a combination of a lot of different oils in it that actually nourishes the face, and it's better than, it's got the frankincense, and it's got rosemary, and it's got a lot of different ones depending on dry skin, oily skin, and normal skin. So, but that's, so, anybody that wants to learn a little bit more of maybe a condition or maybe something that they're working with, and they realize that there is something going on, and they're not getting it, they're not getting any answers from their doctors, or maybe they did testing and nothing's been done. So you can call, let us know, and we can sit with you and sort of walk on and with asking questions. Basically what we do is we don't do any testing, we don't do any blood tests. That's not the way we do things. All the things that we do are alternative, and meaning that all we do is talk with you, we learn about you, and we try to figure out exactly what it is that you're doing or not doing, and correct that. And once you do that, you'll find that understanding the things that you thought were good, one of the things you'll find is that someone will do something that is good, and they go, I thought I was doing something great, but apparently it is good. It is said that it's good, but maybe for that person is not good. So meaning that blood type has a lot to do with this, and that's another avenue that we work with you so that you learn about about the blood type that you are. And once you know that, and if you don't know your blood type, the best thing to do is to go into the American Red Cross and give blood. And the minute you give blood, you right away learn your blood type, and then you get to read it on the book. There's a book that's called Eat Right for Your Blood Type. Learn what your blood type is, and guess what? You end up learning more about what you're all about. And anyway, for anybody that would like to come in or maybe sit with us, and so that we can discuss what it is that your concerns, you can call us at the 651-486-0525, or you can go to our site. You can send us an email. You can call us. I personally would rather talk to you on the phone. I mean, I do email, but I rather talk to the person and maybe visit with you in person. So for anybody that would like more information, they can call us, email us, or come in and visit our place here in our center.